This is Med School Radio. We're looking at First Aid 2020 Immunology, Section 2, page 98. We're going to look at the spleen and the thymus. I'm just reading from the book. Okay, first, let's take a look at the spleen. It is located in the LUQ, or the left upper quadrant of the abdomen, anterolateral to the left kidney, protected by the 9th through the 11th ribs. The sinusoids are long vascular channels in red pulp. So you look at the red arrows in A, with fenestrated barrel hoop basement membrane. T cells are found in the periarteriolar lymphatic sheath, or the PALS, P-A-L-S, within the white pulp. So look at the white arrows in A. B cells are found in the follicles within the white pulp. The marginal zone is between the red pulp and white pulp and contains macrophages and specialized B cells, and is where antigen-presenting cells, APCs, capture blood-borne antigens for recognition by lymphocytes. Splenic macrophages remove encapsulated bacteria. This is very important. So in splenic dysfunction, for example, post-splenectomy state, sickle cell disease, autosplenectomy, there is a decrease in IgM, which leads to a decrease in complement activation, which leads to a decrease in C3b opsonation, which leads to an increase in susceptibility to encapsulated organisms. So the post-splenectomy blood findings, you find Howell-Jolly bodies, which are nuclear remnants, target cells, thrombocytosis, loss of sequestration and removal, and lymphocytosis, loss of sequestration. So vaccinate patients undergoing splenectomy or with splenic dysfunction against encapsulated organisms, pneumococci, HIB, and meningococci. Okay, so next is the thymus. It is located in the anterior superior mediastinum. It is the site of T cell differentiation and maturation, encapsulated. Thymus epithelium is derived from the third pharyngeal pouch, endoderm, whereas lymphatic lymphocytes are of mesodermal origin. The cortex is dense with immature T cells. The medulla is pale with mature T cells and hasal corpuscles containing epithelial reticular cells. Normal neonatal thymus is sail-shaped on chest X-ray and involutes by age 3. So remember, T cells, thymus; B cells, bone marrow. Absent thymic shadow or hypoplastic thymus is seen in some immunodeficiencies, for example, SCID and DeGeorge syndrome. What is a thymoma? A thymoma is a neoplasm of the thymus associated with myasthenia gravis, superior vena cava syndrome, pure red cell aplasia, and Good syndrome. So there we have it, the spleen and the thymus.